Dr. Danyo, it's so nice to see you. How you doing?
Clark, what's going on?
I'm looking forward to another great conversation. I'm always learning new things. We've been doing this for a while now, but every time we chat, I'm always learning of these new techniques, these new styles, new approaches. I'm always learning from you.
We've had so much great feedback from patients, especially consults, people from all over the country. I was just at the International Hair Restoration Surgery Conference in Denver.
How was the event?
So I had a couple doctors. One in particular came up to me and said, "You're Dr. Danyo. Oh my gosh, I've been following your podcast and all the stuff all the videos that you do online on YouTube, and it is amazing what you're doing. I just wanted to congratulate you and just let you know what a good job you're doing for the industry, that was great to hear."
That's got to feel so good. 'Cause I know how much you care about this work you do. That you care about the industry, you care about the patients, the outcomes, the whole process. So that's awesome. I hope you receive that and feel that.
Oh, it's great.
Wonderful. Well, we've got an interesting topic today. I believe it's called preview long hair, right? This is sort of like a full-length hair transplant, right? Still in the FUE category. But this is interesting. So just to set the stage, remind our listener listening along now or watching along now, what again is FUE? And then let's transition to look at the preview long hair transplants.
Sure. Well, FUE stands for follicular unit excision, where we are extracting hair from the back and sides of the head. We can also extract it from the beard, chest, and abdomen. You can theoretically do arm and leg. So essentially the FUE process is taking a very small punch, generally less than 1 millimeter, and we create a circular incision around the follicle, and then we pull it out. So most places, because this is not an easy procedure to do, will either shave the donor site or they will shave the entire head. And for most folks, shaving the head is just not an option. It's tough getting back to work. I mean, let's say somebody has your length of hair and then their head is shaved. I mean, that's a weird haircut for a couple months. And this is a really private thing. We've talked about no shave or shaveless FUE on multiple podcasts, and we've touched on preview long hair transplant in the past, but it's something that we're dedicated to do. It's not easy. There are very few providers in the country that do it. The amazing thing at this international conference was in South America, particularly in Brazil and Paraguay, and even Spain, some places in Europe. There are clinics that only do preview long hair. So we'll talk about kind of the advantages and why you would do that, and possibly some of the disadvantages. But for us, it's definitely another option for people that want to go concealed and also get the benefits of having really the most accurate way of doing this procedure and creating the density and the look really on the fly.
When you mentioned a lot of people out there, they actually have to shave the headpiece. It's just really challenging work. Just, I guess, to paint a picture here, part of why I would imagine if I was trying to do this, if you're working with a bunch of hair on someone's head, I mean, you're going through each individual hair follicle. And so you're probably what makes it hard with a lot of this hair is like you're having to work around all that. Is that one of the reasons why that's so challenging?
Oh, yeah. The scalp is very vascular. So, I mean, you're going to get some bleeding, and it's not severe. I don't want to freak anybody out by saying that, but it's just natural. And so when the head is shaved, it's almost like hitting a golf ball on a fairway, and you can see your ball as you're driving up on the cart to hit the next shot. With no shave and then, preview long hair, a transplant, we're essentially kind of playing out of the rough. We have to find the grafts after we core them, and you just need a team and an approach that's really dedicated to doing this, because FUE is hard to begin with, and then we're taking it to a much higher level doing a preview long hair case. So the nice thing about this is we are taking the full length of the hair. It could be as long as shoulder length or beyond. It could be your length. It could be half an inch. And there are some major advantages to doing preview long hair. So I think that should be our next topic on this. Really, one major thing with preview long hair is the fact that you're actually creating density as you're placing the grafts, and you can actually see the density being built. And it's very exciting for the patients because we can take a break, show the mirror, everybody gets excited. And at the end of the case, it's very close to the final results from the procedure, like immediately. We don't have to wait, 4 to 6 months for the grafts to grow in. So it's extremely exciting. I mean, we literally get before and after pictures same day. The next main advantage is that the hair actually has an arc to it. And that arc is actually key. So if you think of like a periscope, on a submarine, you can just move it a little bit and that arc really changes a lot. So bad hair transplants that I see, the hair can look wild because there's no consideration for curl control. And especially if they haven't really done angle control when they're placing it, the grafts can be angled this way and down and up, and it can look like a mess. So the art of doing long hair is that you're dialing in this curl and you're dialing in the angle. And when you think of the head, with most men, and that's some men do have some pretty wild cowlicks that generally tend to go from the left to the right. But if you're dialing in the hair, it's like a cascading waterfall, especially as it falls to the side, and you can really get that angulation. If the angulation doesn't look right, you can pull it out and replace it and get it right on the fly. So the accuracy is unbelievable. The next aspect is really going to be just that final result. I mean, when the spouse picks up the patient for the day, I mean, there's lots of, oh my gosh, I can't believe this.
I mean, it's the same day. That's what's so unbelievable. They show up and then they leave looking different.
Yeah. And so those are the main advantages. I mean, a lot of places say, why would you do a preview long hair case? Because, it's pretty much uniform that when you move a follicle, the hair within the follicle will shed. So a lot of people that kind of discount this procedure say it's going to shed anyway. Why should people pay a little bit more extra, and why should your team be subjected to higher work? But I think the psychology of hair transplant, we've talked about this before, in knowing that this is being done in the most accurate way possible. You can build it and work with the patient to make sure that it's going in the right place, and you can build a density more appropriately. And that density is obviously a huge issue for folks, and get the coverage that you want. And if the density is not there after you've pulled a certain number of grafts, you can always go back in and grab some more and add to it. So having that ability to, on the fly, really assess and perform this procedure is key, because the hair it goes into a natural growth and rest cycle. And so when you move the follicle, it will go into an artificial rest phase, and that's why it sheds. But having that preview up front, it's major peace of mind for folks. The other aspect that people say with long hair is, especially with hair that's maybe more than about 10 centimeters, is that there's just a massive risk to pull the follicles out. And with the cases that we've done, we just haven't had a single follicle pulled out by a patient. And I spoke with some of the physicians and heard presentations at the International Hair Restoration Surgery Society meeting, and people brought that up. What about the risk of pulling the hair out? And they're not seeing it as well. And we have talked about direct hair implantation, and that's how or DHI. So when we place the grafts, we can see that curl, and then we just directly place it in the head using the DHI or direct hair implantation technique. And that technique really creates a more stable hold on the graft because there's no bleeding when you place the grafts. There's a little bit of blood around the ball, but that creates a really kind of stable clot. And so there may be a little bit of a heightened chance for maybe pulling a graft out, but it's minimal, and it's not anything that should prevent somebody from doing it. And I think it's key if you're interested in doing a preview long hair transplant. The naysayers are out there on the web saying, "Don't do it. It's going to fall out anyway, and it's more expensive, and there's just too much of a risk for pulling the hair out." Well, that's not true.
Right. It's not true, especially if you're Dr. Danyo. Because you said it's that art. You have a skill to be able to do that, and it makes a lot of sense with how, when you're placing it, you have to make sure that natural curvature is preserved. And really interesting. Anything else you want to add on who this is for? I know we've talked about what's involved. Generally speaking, who would you say is great for preview long hair?
I think anybody. It might not be really applicable for somebody with really short hair, although you can grow the hair out and have the advantage of using that curl control and really building the density on the fly and getting a preview of what it's going to look like. But I think anybody that wants to go really stealth, that is interested in having a picture of what this hair transplant is going to look like, and really knowing that this was done at the highest level possible, then preview long hair is the right procedure for you.
Wonderful. Well, I know your team. You provide some wonderful consultations to help folks understand the right option for them, and so this has been really helpful to hear.
Yeah, and I'll be honest, we have a great team, and everybody is up for any new challenge. And for us, this is not like a massive challenge. I mean, it's kind of part of our culture. And, longer hair can be a little bit more difficult to control because when you're storing grafts that are long, the hair can get tangled, and it can be a little bit difficult to control. But we have some techniques where we do a little bit of grafting and then do a little bit of placing, do a little bit of grafting and place. And that kind of keeps things from getting tangled and becoming a mess for everybody involved. The shorter hair, especially if it's about 2 inches or shorter, we can easily just stack up these follicles, and we just stack them all up in the same curl. And we've got a holding solution that is non-osmotic, so it's very good to the grafts, but it's also good to the hair because, the hair, if it's just sitting in saline, can actually absorb some of that. And, hairs actually have almost some spine, they have spines on them, and those spines can actually kind of come out almost like a flower and become more like a tangle. So we have the processes in place to do this, and my team, I can't say enough. They're up for the challenge, and it's a fun case.
That's great. Dr. Danyo, this has been, of course, informative, as always. I'm always learning new things. You and your team, you do a great job. And with that said, I think we're at a good spot to pause, and I can't wait to see you again soon. Thank you so much for the time today.
Yeah, thanks a lot, Clark.
Hey, thanks for listening to Hair Restoration with Dr. Daniel A. Danyo. Book your consultation today with Dr. Danyo by calling 678-845-7521 or online at nahairrestoration.com. And be sure to follow, rate, and review the show anywhere you listen to your favorite podcasts.